There is perhaps no one better at actually describing what single payer is to the public in a way that takes the sound bites and small bits of information out of it. So I'd like to introduce you to Paula Garrett. Good afternoon. I am Paulette Garrett, State Coordinator for PDA, Progressive Democrats of America, and the Leadership Conference for Guaranteed Health Care, the National Single Payer Alliance. As a 2008 Democratic congressional candidate here in Wisconsin's 1st District, health care was the #1 issue on my platform, and single payer was the health care plan I supported then and the one I continue to support now. What is single payer? It is the gold standard of what we should ask for in regards to health care reform. It is 100% guaranteed coverage for all Americans, regardless of job transfer or pre-existing condition. It is called single payer because all expenses would be paid in one publicly administered pool. Single payer combines the best ideas of the left and the right, publicly funded but privately driven by the consumer and their doctor. Single payer fulfills President Obama's 3 principles of cost effectiveness, access, and choice, unlike any other proposal, because it is the only plan that guarantees everybody in and nobody out. President Obama, in his Wednesday night press conference, said, "I want to cover everybody. Unless you have a single payer system, you're probably not going to reach every single individual." If this is what our president said, then what are we waiting for? Single payer legislation in the form of House Resolution 676 would provide automatic coverage for life for everyone, even if you lost your job or you moved. Your health care would no longer be tied to your employment. It would be comprehensive medical services, including prescription drugs, dental, vision, mental health, and long-term care. No co-pays, no deductibles. It would assure your choice of doctor and hospital. Single payer would eliminate the bureaucratic middlemen of the insurance industry who spend 30 cents of every health care dollar for CEO salaries, profits, and paperwork, mostly to deny who needed care, as well as eliminate the powerful lobbyists who influence and manipulate our politicians. Currently, they do this at a rate of $1.4 million a day. Single payer is not socialized medicine that the conservative right wing tries to scare us with. Government bureaucrats that are not going to ration our health care under a single payer system. We already have rationed health care in this country. It's called lose your job, lose your employer-provided health care plan, be unable to afford an outrageously priced private plan, and then be turned away because of a pre-existing condition. We can only go up from here. Single payer will rid us of insurance company CEOs who decide who has medical coverage under our current system. Why would we continue to perpetuate a failed system that puts profits ahead of patient care? Healthcare reform, in the form of single payer, is the real economic stimulus package. The #1 factor affecting an American company's ability to compete in the global economy is employee health insurance costs. Single payer, national health care could realize about $400 billion in savings annually, enough to cover the uninsured and upgrade coverage for all Americans to #1A+ coverage. House Resolution 676 would be funded through a 6.6% payroll tax. Currently, I personally pay $8,000 annually for my private health insurance plan, just for myself. It has a $2,000 deductible, no dental, no vision, no prescription drug coverage. I would have to make over $100,000 single-payer system over our current system, which he has called a mess. However, both President Obama and Senator Feingold recognize that our nation has a long tradition of health care provided through private insurance companies, and that trying to eliminate their influence is almost an insurmountable task. And so, rather than our Congress working along with our President to provide the best solution to our health care crisis through a single-payer system, they are working on a compromise plan that will allow private insurers to remain in the healthcare business alongside a public option. So what does this do for those of us who support single-payer? I brought with me two articles that were published this week. The first one, written by Kip Sullivan, a member of Physicians for a National Health Plan. Kip says, we must continue to educate Congress and the public on the need for a single-payer system. We must also convince advocates of the public option that they have made two serious mistakes. The first mistake was to think a public option that merely took over a large chunk of the non-elderly market could substantially reduce health care costs and thereby make universal coverage politically feasible. Any proposal that leaves in place a multi-payer system, this would be all the insurance companies, is going to save very little money. The second mistake the public option made, Kip says, was to think the insurance industry and the right wing would treat a public option more gently than single payer. If a proposal is going to be abused as if it were single payer, why not actually propose single payer? At least then, when a particular session of Congress comes and goes, and we haven't enacted a single payer system, we will have educated the public about the benefits of a single payer and have further strengthened the single payer movement. My second article, written by Norm Solomon, a historian and national chair of the Healthcare Not Warfare campaign, says that right now in Congress we've heard about the committees debating House Resolution 3200, which would keep the private insurance companies and provide for the public option. Well, Norm has this to say about those committees. Democrats from 3 House committees are working on a public option plan. Under that plan, different levels of coverage, basic, enhanced, and premium, would be offered. Norm goes on to say, for the government to offer a public multi-tier set of options for health insurance, different levels of coverage such as basic, enhanced, and premium, is to imitate the approach of the corporate healthcare establishment. After all, isn't it implicit that the government's plan, different levels of coverage offered to the public, would be based on ability to pay? Missing from the dominant healthcare debate, according to Norm, is a principle that should be debated. Healthcare is a human right. And a human right should not be contingent on ability to pay, nor should it be divided into basic, enhanced, or premium. To sum up, healthcare reform is the civil rights movement of our time. For those of us who support single payer, we